Unlocking functional neurological disorder, shattering stigma and fostering understanding through collaborative learning. Understanding functional neurological disorder, breaking the stigma. Imagine waking up one day unable to move your arm or speak clearly, becoming paralyzed or having seizures, only to be told that there is no clear medical explanation for your symptoms. This is the daily reality for people living with functional neurological disorder, FND. This condition affects the brain's ability to send and receive signals properly, despite no structural damage being present. FND is unique because it intersects physical and psychological health. Its symptoms, such as muscle weakness, tremors, or seizures, closely resemble those caused by conditions like strokes or brain injuries. However, unlike these conditions, FND does not involve structural brain or nervous system damage. This absence of a visible cause can make the condition confusing, not just for patients but also for healthcare providers. Dr. Kate Bailey and her team at King's College London collaborated with experts from NHS trusts and international partners to explore the role of multidisciplinary group education sessions in managing FND. The researchers examined whether these sessions improved participants' understanding of their condition and increased their confidence in diagnosis and treatment. Living with FND, a journey of uncertainty. For many people with FND, life is full of uncertainty. Symptoms often come on unexpectedly, making it difficult to plan daily activities. In addition to physical challenges, many patients experience emotional distress as they struggle to understand their condition. Participants in this study frequently described FND as unpredictable and frightening, leaving them feeling powerless. Researchers used a tool to measure patients' beliefs about their illness, which revealed that people with FND often feel misunderstood and struggle to make sense of their symptoms. This study, organized by the charity FND Hope within St George's Hospital Neuropsychiatry Service in London, offered online group sessions based on cognitive behavioral therapy, CBT, to address these problems. These sessions included input from a neurologist, neuropsychiatrist, psychologist, neurophysiotherapist, and an individual with lived experience of FND. Each session focused on different aspects of FND. Session 1, Understanding Symptoms and the Nervous System's Role. Session 2, Psychological Aspects, including stress and emotion regulation. Session 3, Movement and Physical Rehabilitation Techniques. Session 4, Strategies for Symptom Management and Daily Functioning. Session 5, The Role of Healthcare Professionals and How to Engage with Them. Session 6, Personal Coping Strategies and Future Support Options. Following the sessions, participants reported feeling significantly more confident in understanding their condition, also known in psychology circles as illness perceptions and treatment. They also show greater engagement with healthcare. However, their experiences of emotional distress and stigma did not improve, suggesting that while education is helpful, more personalized and comprehensive support is needed. Additionally, improvements in engagement were not sustained 1 month after the sessions ended. The challenge of stigma. One of the biggest challenges faced by individuals with FND is stigma, negative attitudes and misunderstandings about their condition. Nearly half of the participants in the study reported feeling embarrassed about having FND. Many expressed concerns about being judged or dismissed by healthcare professionals. Over 60% worried that doctors might become frustrated with them or fail to provide proper care. Stigma extends beyond healthcare. Some participants feared workplace discrimination, such as being overlooked for promotions. Others worried about negative reactions from family and friends, leading to feelings of isolation. Stigma can make it harder for people with FND to seek help or advocate for themselves. These findings highlight the urgent need to raise awareness about FND and reduce the stigma surrounding it. Stress, trauma, and FND. Stress and trauma play a significant role in FND for many people. Participants in the study often identified these factors as contributing to their symptoms. Research has shown that stressful life events, such as childhood adversity or emotional distress, are more common in people with FND than in the general population. However, not everyone with FND has a history of trauma. While trauma was once thought to be the primary cause of FND, experts now recognize that the condition can have multiple contributing factors. Some researchers suggest that there may be different subgroups of people with FND, some whose symptoms are linked to past trauma and others who develop the condition without such experiences. This evolving understanding highlights the need for personalized approaches to treatment. Expanding tools to capture factors like stress and trauma better could help healthcare providers offer more tailored care. The need for personalized support. One clear message from this study is that people with FND want more personalized care. Many participants said they needed practical advice for managing their symptoms, support in explaining their condition to others, and access to psychological therapy. Participants also highlighted the complexity of FND. They often attributed their symptoms to a mix of physical and psychological factors, including stress, trauma, and medical events like surgery. This diversity of experiences underscores the importance of tailoring treatment to the individual. Managing FND is even more challenging for people with other health conditions, also known as multimorbidity. Navigating healthcare systems can be overwhelming, especially when dealing with multiple doctors and treatment plans. Providing coordinated and personalized support is key to improving outcomes for people with FND. Issues with the study. While this study offers valuable insights, several challenges were encountered. One of the most significant issues was the low completion rate. Although 166 participants attended the educational sessions, far fewer completed the follow-up surveys. This high number of people who left the study limits the strength of the findings because it is unclear whether those who remained engaged had different experiences from those who did not. Another limitation was the nature of the survey responses. Many participants gave brief answers, particularly when discussing the role of trauma in their condition. A more in-depth approach, such as interviews, could have provided deeper insights. Additionally, because the study relied on self-reported experiences, there is always a risk of bias. Finally, while the study highlighted the need for an FND-specific adaptation of a tool used to measure illness perceptions, larger sample sizes would be needed before significant changes to this tool could be made. Expanding the study to include more participants and using different data collection methods, such as interviews or focus groups, could strengthen future research. Looking ahead, advancing understanding and care. This study highlights the need for a deeper understanding of FND and its many contributing factors. Developing tools specifically designed for people with FND could provide more detailed insights into their experiences. Education can help improve understanding and engagement, but reducing stigma and offering personalized, comprehensive support are equally important. By listening to the voices of people with FND and addressing their unique challenges, we can work toward a future where this condition is better understood and more effectively managed.